some critical things and some high yield stuff you need to know about pregnancy. So what to know about pregnancy for the NCLEX exam, because it's a big thing, you know. Pregnancy is big. So you want to really make sure that you are mastering this particular topic so far as the NCLEX is concerned. And so I'm going to really take my time so that we can get into it and then break it down and really get all the concepts. So the first thing I want you to know is, how will I be able to determine when a baby is likely to be born? Okay. Usually for the NCLEX, you need to know these three rules. Number one, I call it the Nägele's rule. And then we also have the McDonald's method. And then we can also have what we call the time of quickening. We're going to get into each of them to learn, you know, how to use them and then how to solve NCLEX-based questions so far as these rules are concerned. Okay, so the first thing I need you to write is Nägele's rule, McDonald's method, and then the time of quickening. What does each of them stand for? Or how do I use any of these rules and methods? All right. So, as I said, these are three ways that we can use to determine when a baby is likely to be born, basically. And it helps us to know the estimated date of birth, EDB. Okay, so let's start with the Nägele's rule. Why are we learning about Nägele's rule? Nägele's rule, like the McDonald's method and like the quickening method, is one of the three ways that we use to learn how and when a baby is likely to be born, the expected date of delivery. Okay, so the Nägele's rule, it is based on a calculation. And so the calculation is, number one, you take the first day of the last menstrual period, the first day, and then you subtract 3 months from it. So the first day of the last menstrual period, and then I subtract 3 months from it, and then I add 7 days. I'm going to take my time. Take the first day of the last menstrual period, subtract 3 months from it, and add 7 days. You know, for the Nägele's rule to be able to work very well for you, number one, the pregnant patient must, prior to getting pregnant, have regular 28-day cycle. Okay. And for you to be able to be sure that the Nägele's rule will work, the client must tell you that the date of the last menstrual period, they are sure about it. Like if the client is not very sure, the Nägele's rule will not give you an accurate presentation. But how do I calculate the Nägele's rule? Number one, I will subtract 3 months and then I'll add 7 days. So let's get our papers and pens and let's try something. After that, we'll go into the discussion itself. So can somebody tell me, you're going to basically subtract 3 months and add 7 days, minus 3 months plus 7 days. So if I have a patient whose last menstrual period will be September 9th, okay? If I have a patient whose last menstrual period will be September 9th, when is the patient likely to give birth? Can somebody tell me? We are using the Nägele's rule. If I have a patient whose last menstrual period will be September 9th, 2024, when is the patient likely to deliver? Can somebody tell me? So we are using the Nägele's rule. That's the first rule. So September 9th, right? Last menstrual period is September 9th. September 9th, 2024. So we said we're going to subtract 3 months from it, minus 3 months. So please, what does that bring us to? September minus 3 months. What is that? September. So if we go back, August, then we go back again, July, then we come to June. So minus 3 months would be June. Okay. And then plus 7 days. Plus 7 days. Plus 7 days. So what would that bring me to? September 9 plus 7, that should be 16. So then the expected date of delivery, expected birth date will be June 16th, 2025. Please, how many of us got that? Nägele's rule. Because in the NCLEX, you can, is beautiful, beautiful. Mary got it. Risikas got it as well. Awesome. Okay. So I'm so proud of you. So let's try another one. Let's try another question. We just did September 9th. So we got it. June 16th, 2025, not 2024. 2025. Let me change it there. 2025. 2025. Not 2024. 2025. Okay. Okay, good. So now let's come here. Okay, what about if I tell you that you use the Nägele's rule to calculate the expected date of delivery for a patient whose last menstrual period was May 7th, 2024. May 7th, that is today. May 7th, 2024. What will be your answer? May 7th, 2024. What will be your answer? May 7th, 2024. What will be your answer, please? May 7th, 2024. What will be your answer? Let's go back to our whiteboard. Today is the last day the first day of menstruation, May 7th, 2024, minus 3 months. Please, what does that bring me to? Minus 3 months. What does that bring me to? Minus 3 months. So that would be what? May. So we go to April, we go to March, we go to February. So that would be February. Okay. And then 7 days plus 7. So plus 7 days. Plus 7 days. That should be what? 14. Oh, okay. So this baby will be born on Valentine's Day. February 14th, 2025. Please, are we all on the same page? I want to make sure.
Yeah.
Beautiful, 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 beautiful. So Nägele's rule. Nägele's rule. Last menstrual period, May 7th, 2024, minus 3 months, plus 7 days, will bring me to February 14th. Please, are we all on the same page? Beautiful.
Yes.
Okay, good. That's awesome. That's encouraging. People are paying attention. So if I go to my notes, my lecture notes, what did we have there? Beautiful. That is it. Boom. February 14, 2025. So please, for your NCLEX, remember, you should be able to ace this with no issues. When it comes to Nägele's rule, you should be able to use the Nägele's rule and ace the NCLEX with no questions whatsoever. So I will continue with this. What about the McDonald's method? We learned about the Nägele's rule, but what about the McDonald's method? The McDonald's method, so Nägele's rule is more calculation. McDonald's method, we are going to measure the tummy of the patient, okay? The tummy of the expectant mother. And then we're going to use that to help us to estimate when the baby will be born. So we use what we call the fundal height, okay? So we measure from the symphysis pubis to the top of the uterus. So from the hip bone, that area down there to the top of the uterus. And usually it is best used if the pregnancy is between 22 and 34 weeks. 22 and 34 weeks, 22 weeks and 34 weeks. So what do I mean by this? We usually use the distance in centimeters times 8 over 7. And that gives us the total weeks of gestation. Let me say it again. The distance in centimeters, right, times 8. So if it is, say, 21 centimeters, so it will 21 times 8 divided by 7. That gives us when the baby is likely to be born, or, how old the fetus is. So we've learned the Nägele's rule, minus 3 months plus 7 days. But then we are learning the McDonald as well. And I'm asking, with McDonald, do you have any question? I have a question for you. Using McDonald's method to calculate how old the fetus is, if the measurement is 23 centimeters, right? If the measurement is 23 centimeters, how old is the baby? Or how many weeks is the baby? So step 1 is 23 times 8, and that will give me 184. And then the next step will be 184 divided by 7. So that will give me 26 weeks. So using the McDonald's method, I'll first multiply the measurement I get by 8, and then I divide it by 7.